Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about dental phobia. Dentophobia could be classified into several factors. Almost all patients who have this phobia fear a couple of factors, while patients with severe dentophobia could fear every one or perhaps the majority of factors at the same time. Experiencing the feared stimulus would cause a sudden fear reaction that might take the shape of a panic or anxiety attack. The dental phobia leads to a great deal of stress and additionally has an effect on different elements of everyday life, not only your oral healthiness. The key challenge with describing dental phobia is the fact that there isn't only one form of dental phobia, on the contrary, quite a few forms, a few reasonable but some which appear a lot more unreasonable. Another challenge with explaining dental phobia is the fact that dental anxiety, a response to a not known danger, might appear just like frightening of a dental phobia to a patient. Additionally, certain patients who've never ever experienced a bad experience with a dental surgeon or a dental treatment could establish dental fear or dental phobia. Who have fear of dentists? Your dental surgeon's eyes, looking over the sterile cover mask. Leaning back into the dentist seat, pinned down by the weighty protecting bib that safeguards the human body from waves throughout tooth x-rays. Scraping with pointed instruments to chip away the spots on the tooth enamel. After that the dental surgeon toothbrush, accompanied by suctioning and also sprays of fluid from the small fluid jet. It looks like a normal visit to the dental surgeon. However, for a lot of patients with certain level of dental phobia, officially known as dentophobia or perhaps odontophobia, it's the most awful feel in life. Either because of genes or plain luck, oral health differs significantly from individual to individual. Certain individuals are able to keep going for a long time between dental professional appointments with minimal effect on their teeth or maybe gums. Some people have problems with decay and periodontal health problem, regardless how regularly they brush and floss. Unless you are among the blessed few, dentophobia might have serious effects in your lifetime. A difference is made between dental anxiety, dental fear and dental phobia. Dental anxiety is a response to a not known danger. Anxiety is very typical and a good number of patients feel certain level of dental anxiety, particularly if they're going to have something carried out which they've never ever undergone before. Generally, it's the anxiety of the unknown. Dental fear is a response to identified danger, which includes resistance or flight reaction when faced with the dangerous stimulation. Dental phobia or dentophobia. Dental phobia is actually the identical as fear, just significantly more powerful. The battle or flight reaction happens if simply thinking about or perhaps reminded of the critical issue. An individual with a dental phobia are going to stay away from dental care no matter what until possibly a physical situation or perhaps the mental pressure of the phobia gets too much to handle. Most likely, going to a dental surgeon won't be closely as unpleasant as you anticipate. Testimonials of people before and after the very awful treatments, for example a root canal or perhaps wisdom tooth removal, have discovered that they expected a lot more pain compared to they really felt. The root canal especially have a nasty reputation simply because it is usually preceded by unpleasant toothaches. The treatment on its own eliminates this discomfort, generally in only one visit. Wisdom tooth removal have a bad name due to periodic jaw discomfort felt sometime later on, that could be handled with medications. Yet, even though your brain says you'll be alright, you can still worry about dental surgeon's chair. Cause of dental phobia. Dental phobia is frequently a result of terrible or in some instances horror experiences at a dental surgeon. This not just involves unpleasant dental care appointments, but additionally emotional behaviors, for example being embarrassed by a dental surgeon. Dental phobia is usually typical in patients which happen to be sexually abused. A memory of bullying or perhaps being physically or maybe mentally abused by an individual in authority may additionally cause creating dental phobia, particularly along with bad encounters with dentists. It is actually frequently believed, also among dentists, that it is the anxiety about discomfort that drives away patients from visiting a dental surgeon. However, in fact, where discomfort is the person's primary problem, it may not be pain by itself that could be the issue. Elsewhere, dental phobics will likely not stay away from the dental professional despite that they have discomfort from toothache. Pain brought on by a dental surgeon who is considered as responsible is significantly less likely to lead to mental trauma. Additional reasons behind dental phobia contain negative, embarrassing comments by a dental surgeon or oral hygienist. In reality, harsh comments and the strong feelings of disgrace lead to one of the primary elements that may lead to or create a dental phobia. Negative public evaluation are going to disturb many patients, other than the mentally stable people. In case you are the delicate type, harmful assessment could be shattering. In case a parent is scared of dentists, kids could learn to be scared too, even in the lack of terrible memories. Listening to some other people's scary testimonies regarding appointments to the dentist could have an identical impact. Likewise, the image of the dental surgeon in the media could lead individuals to establish dental fears. Comprehensive Guide How to Conquer Dental Phobia. If your dentophobia is extreme and also paralyzing, it is advisable to seek advice from an emotional and mental health expert prior to starting your dental therapy. Mental behavioral treatment, remedies and even hypnosis may enable you to get your anxiety manageable. As soon as your dental phobia is at a controllable degree, it is possible for you to go to the dental surgeon. But, you will need to select the right dental surgeon. However, not every dentist uses the similar methods and strategies to help individuals with phobias. Consult relatives and buddies if they could suggest dentist, or perhaps search for dentist who promotes themselves like a specialist with nervous patients. When you've discovered dentist you believe could be appropriate, check out the dentist office to take a look around, speak to the dental assistant and dental surgeon and observe the surroundings. Inform the dental surgeon that you're nervous so that they understand in advance. Look for a visit earlier in the morning so that you have minimal time to think about it. Attend that initial visit with somebody you trust, for example a family member that has absolutely no anxiety about dental treatments. As soon as you require the treatment, describe that you experience dentophobia and that you are not prepared to make a reservation or complete treatment. This first appointment will help you to create connection with the dental surgeon and also get to know his method and approach. Experiment with relaxation methods, controlled inhaling and exhaling, taking a huge breath, holding it and then allowing it away really gradually. This tends to stabilize the heart rate and also loosen up your muscle tissues. One more method is gradual muscle tissue relaxation, which includes tensing and then relaxing totally different muscles in turn. Shut your own eyes. You don't have to observe the tools, particularly not the needle. Focus on relaxing your muscle tissue one by one. In case your dental surgeon doesn't currently have one, request from him to put a picture of a peaceful place or perhaps something on the upper wall above the dental chair. Doing this, if you choose open eyes, there's one thing non-medicinal to see. When you move on to next visits, keep in mind that you are at all times in charge. Determine a sign with your dental surgeon that you could engage if you want a rest, along with a different sign to let the dental surgeon realize that you will need additional anesthetic. Lots of patients love to carry a MP3 player or perhaps DVD device to their visits. These things may take your focus away and allow you to loosen up. Once you're back in your own home, put ice pack on your jaw and wash delicately with heated salt water at any time you're uncomfortable. This manages inflammation and irritation, each of which lead to a great deal of the post-procedural discomfort. Study signifies that patients who have experienced awful dental treatment are afflicted by signs usually noticed by individuals with post-traumatic stress disorder. It is identified by intrusive feelings of the terrible feel and bad dreams regarding dentists or perhaps dental scenarios. Dentophobia is a frequent phobia. Without treatment, it could result in a variety of physical problems. Visit a mental medical expert first to get your phobia manageable. After that, look for a dental surgeon which makes you feel relaxed. Choosing a dental surgeon that you completely have confidence in is really worth the time and effort. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedyland. Take care.